Q. What's the coronavirus? Coronaviruses are a family of many viruses that may cause fever, respiratory problems, and sometimes gastrointestinal symptoms too. The 2019 novel coronavirus is one in every of 7 members of this family known to infect humans, and therefore the third within the past 3 decades to leap from animals to humans. Since emerging in China in December, this new coronavirus has caused a worldwide health emergency. How does it spread? It's likely to be transmitted in droplets from coughing or sneezes, and therefore the virus includes a 2 to 14-day period. Meaning people may well be infectious for quite a while before symptoms like fever, cough, or shortness of breath emerge. What are the actual symptoms of COVID-19? In the confirmed cases to this point, most of the people get a fever with a dry cough. Smaller numbers of oldsters might experience shortness of breath, a raw throat, or a headache. How am I able to avoid catching the coronavirus? Wash your hands, 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 wash your hands. You get the purpose. Clean all of your tech equipment. A bit like your hands, your smartphone and keyboard and headphones, and the rest gets germs on that. Are you a healthcare worker? If not, do not buy a face mask that depletes supplies for the health professionals who need them. Same goes for gloves. See, wash your hands, above. If you're in an exceedingly high-risk group, over 60, have pre-existing lung disease, cardiovascular disease, diabetes, or a weakened immune system, you must seek treatment if you get sick, since it can quickly go from cough to full-blown pneumonia. Call your doctor or clinic first along with your suspicions in order that they can direct you appropriately. If you are not in an exceedingly high-risk group, better to self-isolate reception with many fluids and anti-fever meds. Odds are you'll recover, and this fashion you will not expose anyone. Still call your doctor, in order that they know what is going on. They is also ready to direct you to people at the health department who can conduct testing. Don't attend the ER unless you're really experiencing life-threatening symptoms. Q. Is COVID-19 more deadly than the flu? That remains to be seen. In step with preliminary estimates from the Centers for Disease Control and Prevention, the 2019 to 2020 flu caused 19 million to 25 million illnesses and up to 25,000 deaths. The COVID-19 numbers are harder to calculate because it's not yet clear what percentage people are infected. The CDC calculates the death rate at about 2%, which is over the flu, but the important number could be plenty lower, because less severe cases might not are reported. People with more mild cases won't even attend the hospital, and healthcare workers may need mistaken cases for the flu or for pneumonia. If epidemiologists count only the foremost severe cases, the death rate will look higher because a better proportion of these patients die, so that may not offer an accurate reflection of reality. Related stories: people spraying the streets with disinfectant. Public health: could the S contain a coronavirus outbreak? American citizens wave from a bus as they leave the quarantined Diamond Princess liner. Opinion: COVID-19 will mark the top of affluence. Politics: image may contain human, person, military, uniform, officer, jacket, coat, clothing, apparel, door, and guard. Outbreak: did a girl get coronavirus twice? Scientists are skeptical. The biggest difference between the two kinds of infection is that the health system is healthier prepared to fight the flu. It comes each year and, while some strains are more severe than others, doctors understand how to treat and forestall it. COVID-19 is uncharted territory, because scientists have such a big amount of questions about how it spreads, and there isn't a vaccine for it. Q. How did it get its official name? The International Committee tasked with classifying viruses has named the new one SARS-CoV-2, due to its close genetic ties to a different coronavirus, the one that causes SARS. However, the disease caused by SARS-CoV-2, remember, that is the disease characterized by coughing, fever, and respiratory distress, is called COVID-19. It is the name officially bestowed upon the ailment by the Planet Health Organization, whose task was to search out a reputation that did not demonize a selected place, animal, individual, or group of individuals, and which was also pronounceable. It's pronounced a bit like it sounds, COVID-19.